Good evening, all the aspirants present here. So, the topic for today is brain death and organ donation, and it is a CBS session. All the students are requested to kindly mute their mic and always unmute when it's required. If any doubt, any question, please drop it in the chat box, and it will be an interactive session. Thank you.
Yeah, so is it visible in slide share mode?
Ma'am, it's not visible in slideshare.
It's always why I don't know. This is the problem. I'm
Uh,
doing slide share only. This is the slideshow mode. So right now I'm in a slideshow.
okay. Ma'am, aspirants, are the screen visible to you?
Yes, the screen is visible, but not in slideshow like you pointed out.
Yeah. So, ma'am, I think we can start like that because
Yeah,
it's not in the
because
slideshow. Okay.
yeah, from my side
Okay.
it's slideshow
And
only.
okay, it's fine. And the speaker that we have here is Dr. Shraddha Patharkar, ma'am. She is an associate consultant at ABMH Hospital, Pune. Thank you, ma'am. You can-
Yeah. Hello everyone. Last time we have gone through CCS of neurotrauma case, and some of the slides were covered in that session only, though those were from CBS. So some slides might get repeated. So we'll start with one case, and I'm hoping this is the interactive session. It's not properly not the I've not made all the questions. It's some theory part, and mostly it's interactive. So we'll start with a case. 16-year-old boy. He had gone for bicycling tour with his friends on weekend. After a while, his colleague found him collapsed on the road, for which EMS team was called for. That time his heart rate was 160 per minute, BP was 190 by 120, and he was tachypnic, he was sweaty. GCS was E2 M2 V1, pupils were 4 bilaterally sluggishly reacting to light. He got intubated at the site and shifted to nearby hospital. On arrival, his ECG was like this. So from the history and from the ECG, can anybody uh, point out what is this? I mean, what he has suffered from? You can give differentials also. It's better to give differentials.
Brugada syndrome.
Not actually.
It could be. So
Yeah,
this
but it
is
can be cardiac etiology also, considering his age. You can put differentials because he became
Um,
unresponsive. He had collapse.
differential regarding ECG or his traumatic brain injury.
See, now everybody knows this is the traumatic brain injury topic. So definitely you'll think that way. But in my exams, we got a similar question. So many a times the UK, these scenarios are based in UK. So going on weekend parties, he's having sympathetic hyperactivity, and then he became unresponsive. So maybe he because of unresponsiveness he collapsed, or maybe he collapsed and became unresponsive. So you have to put, there might be channelopathies, there might be hypertrophic cardiomyopathy with a new ACS event, sudden cardiac arrest. Deep T wave inversions, again you can put ACS also one of the differentials, but it's not that common in such a young age. But definitely hypertrophic cardiomyopathy or sudden cardiac arrest because of some channelopathies, or the
So
ECG
the
doesn't look
patient can
tachycardic.
have drug abuse with cocaine.
Yes, yes. So probably
Couldn't
he
it
must
be
have had,
Takotsubo disease?
you can label it as Takotsubo also. So that's what you have to give differentials. So you can put it as a NSTEMI, but for his age, it doesn't look like that. So maybe any channelopathies, hypertrophic cardiomyopathy leading to sudden cardiac arrest, or some arrhythmias and cardiac arrest, and definitely sympathomimetic drug poisoning causing stress cardiomyopathy. So what else you'll do? Now you're thinking ki this might be cocaine intoxication or LSD intoxication, some substance abuse, and then he had collapse. And ECG showing such cerebral T waves. We call it as a deep cerebral T waves. So what you will do next?
We have to calm down his sympathetic drive firstly with the help of sedation, analgesia, and if required, neuromuscular blocker. And simultaneously, we have to hydrate the patient adequately.
Yeah, you always go through airway breathing circulation. Airway you have already secured.
Already secured now.
Yes. Breathing circulation, again you are thinking this might be cerebral event also. So repeated neuro monitoring, pupillary charting, you need to do that. And next step will be,
Cardiac point of cardiac mode.
yeah, you do bedside 2D echo, see for any regional wall motion abnormality, apical ballooning. You have to again evaluate. He's a young fellow with sympathetic intoxication, so it might be some cardiac problem, or it can be because this was the case for us
Traumatic
during our
brain
unit. So you have to attend CT brain
incident.
because he had this maybe because of this drug abuse, sympathetic overactivity, he might have bled in the brain. So the next slide, even in my exams, though we did not like we focus more on a cardiac, it was it was IC bleed. So now CT was done, and this is the picture, CT brain actual cut. Can anybody tell me what is this? What is the diagnosis?
Slide is not moving. Or slide only.
For me, it's moving. I don't know. Every time it's the problem. Now my laptop is also changed.